Namaskaram to everyone. As some of you, majority of you, will know the meaning of the word Namaskaram here. But Namaskaram means I bow down to the goodness and divinity in you. I come from Hyderabad, which is the capital city of the southern Indian state of Telangana. We're bang in the center almost. I've always believed that gratitude is the best attitude. And on this occasion, I would like to take this opportunity to express my heartfelt gratitude to my friend whom I have known for 25 years, Miss Rachel Hargest, and through you, Rachel, to the London School of Economics and the Royal College of Surgeons of England for this singular honor. I would like to pay tribute to my mentors, both in India and in the UK, before I begin, through this celebrated verse from an ancient Hindu scripture, Skanda Purana, which says, Gurur Brahma, Gurur Vishnu, Gurur Devo Maheshwara, Gurur Sakshat, Parabrahma, Tasmai Sri Guruve Namaha. To put it simply, what it states is Guru, who is the teacher, is the creator of the knowledge, sustainer of the knowledge, and the destroyer of ignorance. And Guru is supreme, and I bow down to my teachers everywhere and to my mentors. I'd like to, because I'm in the UK, I'd like to pay tribute to 5 of my mentors who shaped my life and my career. When I came to the United Kingdom 30 years ago in 1996, I went straight to Caithness, which is just short of Land's End, to do the very renowned course conducted by Mr. Pradeep Datta, who came from India and passed his FRCS from 4 colleges. I came there to do his course and then sit the final FRCS exam. And when I said I wanted to sit FRCS from one of the colleges, then he used the words, why don't you aim for the stars just like me? Why don't you sit FRCS from all the colleges? And to cut a long story short, in April, May 97, I passed FRCS from Edinburgh, Glasgow, and Ireland. Those days, I could not, get the dates for England because it was a clash between theory, viva, and clinicals. And so I couldn't sit the English college exam. So it was a record that within 2 months, I could pass FRCS from all the 3 colleges, and that's all thanks to him. And here is my mentor, Professor Mansell, a world-leading breast surgeon, professor of surgery, professor of breast surgery, was the chairman of the Division of Surgery at the University of Wales, and he was the program director then of the Higher Surgical Training Program, and he spearheaded one of the world's largest landmark almanac trial, which showed that sentinel node biopsy should become the standard of care for early breast cancers. And that was the time I had the opportunity to do my first training post with him. And he was such a simple, grounded man. And he actually inspired me to take up breast surgery as a career. And then as I moved on, in early 2000, oncoplastic breast surgery was just evolving. And the training interface group, if I'm not mistaken, Prof. Mansell, which was created by the Association of Breast Surgery in the UK, which was at that time part of the BASO, in partnership with the British Association of Plastic Surgeons, identified 9 positions in the United Kingdom, and they were open to year 4, year 5 higher surgical trainees who were going to become consultants. And I happened to be one of the first from the Indian subcontinent to apply and to get on to this highly competitive oncoplastic training positions. And I happened to work with Professor John Robertson and Professor K.L. Chung, who were actually my mentors. And I'm so very grateful to them who are watching this online today. And finally, before relocating to India, after my mother was diagnosed with breast cancer, I had the opportunity to work with Mr. Quercy della Rovere, who was a fatherly figure to me, who guided me, and who actually actively encouraged me to relocate back to India. And that was when I was working at the Royal Marsden Hospital. So the aim of my presentation today is to share how performance driven by a commitment to excellence laid the foundation for meaningful reform and how those reforms transformed the delivery of breast healthcare in India over the past 2 decades. And as the saying goes, everything begins with a story, and my real story began when my mother was diagnosed with breast cancer in 2002. And it was well and truly the turning point in my life. Whilst inquiring about her care in India, I realized that breast surgery was not a subspecialty. There were very few dedicated breast specialists. The concept of breast centers was non existent. There was very little awareness about the importance of early detection, and counseling, which is such an important component of cancer care, was not even part of our medical curriculum. A situation where a woman would find a lump in the breast, she would report to the gynecologist or a doctor, her GP. She would be referred for a mammogram, which may or may not happen on the same day. Even if it happens on the same day, the result is not informed straight away. The patient has to come back for the report, and basically, finally, the surgeon comes into picture. Triple assessment, not common. FNAC, very common. Co-biopsy was not standard of care. And frozen section, women not knowing whether she would wake up with the breast or without the breast. And the scenario, yes, it looks like cancer, come in on Monday, we'll do a frozen section and decide. Breast cancer has overtaken cervical cancer to become the commonest cancer affecting women in India. 200,000 new cases are diagnosed each year. And compared to the West, where most breast cancers are common after the age of 50, in India, the most number of breast cancers are diagnosed between the ages of 40 to 50. And 100,000 deaths per annum. A woman is diagnosed with breast cancer every 4 minutes, and someone somewhere in the country succumbs to the disease every 8 minutes. For every 2 women who are diagnosed with breast cancer, one succumbs to breast cancer. It's a closet issue. It's always hushed up due to lack of awareness and absence of a population based screening program which is robust. More than 60% of breast cancers present in the advanced stages. This is a patient of mine who lives in Hyderabad from an affluent family. Because of the taboo associated with it, she presented with a locally advanced right breast cancer. Much as my wife, Dr. Vaijayanti, and me had rewarding career opportunities in the UK, we decided to relocate back to India, lock, stock, and barrel, to care for my mother and to serve my motherland. It was not an easy decision, but I relocated back not just to work as a consultant in a hospital, but to hopefully bring about meaningful change. And I had dreams. The first dream was to introduce the breast center concept to standardize care. The second was to establish a foundation to create that much needed awareness. Third was to implement a population-based screening program to ensure early detection. And finally, in my professional lifetime, to see breast surgery evolve as a distinct subspecialty. I was acutely conscious of the fact that dreams are dime a dozen. It is the execution that counts. From time to time, many of you will come across these images, which I will highlight. This is the Charminar in Hyderabad. So the first was breast center concept. In evaluation of someone with a breast health issue, there should be only three outcomes. Either there's no problem, there's a diagnosis of benign lesion, or a diagnosis of cancer, and assessment should end at diagnosis and not before. What defines a breast center is not buildings. It is the people who work at the breast center. Just as a stethoscope is required for a physician, the eyes and ears for a surgeon practicing breast disease is a good radiologist and a good pathologist. I recognize this whilst working in the UK, and well before relocating to India, we identified a radiologist who would come here to the UK and get trained in advanced breast imaging and also in the assessment of screen detected cancers, because it was very, very robust even at that time through the NHS breast cancer screening program, which was virtually non existent in India, and that kind of expertise. So she came, she got trained, and then she relocated back. And we built the breast center as a multidisciplinary service from day one, not surrounding an individual surgeon, but around a trained team. We are all aware here that 30 years ago, more than 30 years ago, there is robust evidence that improved outcomes for breast cancer or indeed benign breast disease or breast conditions can be achieved if specialists with a declared interest and training manage patients in exclusive dedicated breast centers. Mirrored upon the world's first breast center established in Van Nuys by Professor Mel Silverstein, and my experience of having worked at Cardiff, Nottingham, and the Royal Marsden hospitals in 2007, mirrored upon the NHS breast unit model, we conceived, designed, and established South Asia's very first purpose-built, freestanding, comprehensive breast center. The picture that you see on the left has a lot of emotions attached to it. As you can see, the breast center has been established in my mother's name. In India, in a private hospital, no management will allow a private name to be associated. The management actually went out of their way to include my mother's name. And that's why I'd like to mention the name of this person who is there in every single presentation of mine. I'm hugging him, and that is Dr. Bhaskar Rao. He's the chairman of KIMS Group of Hospitals. It is because of him that we could establish the breast center. This is not just a cancer center. This is a center where the entire assessment relating to any aspect of breast health happens in a freestanding, purpose-built center by a dedicated team who manage patients with empathy and compassion. And as 9 out of 10 breast health issues are benign, the essential aim of a breast center is to reassure the vast majority of women who are well but are worried because they think they have cancer. Building a comprehensive breast center is never ever an achievement of one individual. No one can whistle a symphony. It takes a whole orchestra to play. So with a lot of care was taken to ensure that we had a proper multidisciplinary service. And I'd just like to narrate a couple of incidents when we started the journey. This was inaugurated by the then Union Minister for Women and Child Welfare, Mrs. Renuka Chowdhury. After this unit was inaugurated, there was a lot of skepticism, mockery, and even resistance from colleagues and others who were not only skeptics but also jealous. What is this breast center concept? Because the biggest misconception is a breast center was at that time synonymous with a breast cancer center. There used to be queues outside our chairman's office saying that this is not a viable proposition. This will not be a sustainable project. This will bring disrepute to the hospital. And I must say that Dr. Bhaskar Rao, with his vision, conviction, and courage to stand rock solid behind my dream, despite so much of negativity, and that is why I put his name in every slide and he's in my prayers every single day. That unwavering institutional support proved to be transformational to the fact that we were able to establish a breast service in India. 9 out of 10 breast health issues are benign, yet many arrive very worried, terrified. that they might have cancer. And therefore, one of the main responsibilities of the breast center is to reassure them with empathy. And the breast center should be able to treat women with benign breast diseases and breast cancer equally. And the second aspect of the breast center, any sufficiently advanced technology is indistinguishable from magic. We also were one of the first centers. In fact, we were the first center alongside Tata Memorial Hospital to acquire a full field digital mammography system in 2007. When we acquired this, again, we were ridiculed. What's the big deal? What's the difference between conventional mammogram and a digital mammogram? Because most people fail to recognize that breast cancers, when they're present in India, the peak incidence is between 40 and 50 when the breast is very dense. You can't pick up a screen detected cancer when the breast is very dense. And that is where digital mammography was a revolutionary advance, which was just actually installed at the Royal Marsden Hospital in 2007. And of course, we moved on and we were able to acquire the 3D mammography system, this latest generation as well. Very few appreciated the advantages of digital mammography at that time. Superior quality image, better detection in women with dense breasts, lower recall rates, seamless image storing and transmission. What was a ridicule then, people started understanding that digital mammography is here to stay. And today, digital mammography and digital tomosynthesis is the global standard of care, and several centers started acquiring. When we acquired it, it was a phenomenal cost. And naturally, as a private hospital, management were very cautious. They were not very keen to purchase it, but it took me time to convince them. They were convinced and they bought this. And again, that credit goes to Dr. Bhaskar Rao. I'd like to say that innovation often looks unnecessary until it becomes indispensable. And vision is about seeing tomorrow when everyone else is judging today. After the breast center was established, within the first 3 months, we started an aggressive, opportunistic breast screening program where we hired a mobile bus with a digital mammography unit and ultrasound scan machine. And we had a radiographer and our radiologist who actually conducted this screening program. We pre-identified eminent centers in Hyderabad, and over a 3 month period, we screened 950 women for, they're all basically normal women over the age of 40, essentially screening. Mobile screening was not new to India even then, but what was unique at that time is, what was unique was we partnered with the Jarvis Screening Center, where we had two radiographers and a radiologist from St. George's Screening Center to come to India, spend 3 months, and the mammograms were triple reported. In UK, radiographer reports mammography. So the radiographer from UK, the radiologist from the UK, and the radiologist from KIMS hospitals reported the first 950 mammograms. And therefore, our learning curve picked up from then onwards. Also, by the time we completed this 3 month exercise, the entire city came to know about mammography, screening mammography, mobile screening, etc. And so we started picking up very early cancers. Obviously, it's an opportunistic screening where people presented with very early cancers. And I'll just share a couple of examples. A 51-year-old lady who walked in, one of my first patients, she's a psychiatrist, small cluster of pleomorphic microcalcifications. We were one of the first centers to have done the stereotactic core biopsy confirming cancer, and she underwent breast conserving surgery, oncoplastic breast conserving surgery. A 56-year-old lady, routine screening, intracystic papillary cancer. A 45-year-old lady, tubular cancers. They were picked up, and we learned a lot from this exercise in the first 3 months. And 4 impalpable cancers were treated. This created a lot of awareness, as I said, and women started presenting themselves for routine screening. The number of breast conserving surgeries picked up, and oncoplastic breast surgery, which was very nascent in India in early 2000, started. Patients were presenting with early breast cancers. We were able to do oncoplastic breast conserving surgeries, and many of these patients were so impressed with the results that they started speaking about it, not just amongst people, but also went to the media and said the real benefits of having not just breast conserving surgery, but oncoplastic breast conserving surgery, where attention is given not only to remove the imaging abnormality, but also to give good aesthetic outcome. We had several celebrity visitors, some unannounced, who had come. One of them was the then United States ambassador to India, his wife, who had a mastectomy and found out about the work we were doing and came from Delhi to visit her. And she became our patron. And wherever she went, she said, "Your story is one that I will repeat many times when I speak with breast cancer survivors in India and in America." We had the then British High Commissioner who paid an unscheduled visit to the breast center. Later on, we had another British High Commissioner. We had a very eminent author, Shobha Dey from Mumbai, who had come to Hyderabad, a very well-known actor, Shabana Azmi, the former Miss World or Miss Universe, Diana Hayden, and many others. So what the breast center achieved is rapid access to diagnosis by way of triple assessment, better multidisciplinary decisions, standardized care, improved cancer detection, reduced anxiety, unnecessary surgery avoided, and improved patient experience. Most importantly, women were reassured in a compassionate and caring environment. And so the breast center concept proved to be successful. It emerged as a solution to cater to a large number of women who required high quality breast health evaluation. And I must say that the organization and delivery of the breast service in Hyderabad happened not by serendipity, but by diligent planning and focused actions. And it became a major advance in the management of a common, emotionally publicized cancer. The real success of the breast center is not measured by the number of cancers it treats, but also by how many frightened women it reassures. And we are delighted to have introduced the disruptive change of breast center concept and how it is understood in the Indian subcontinent. And today, there are several breast centers that are doing excellent work comparable to any center anywhere in the world. This is the Buddha statue, and I'll come to that a little later on. The second component of my presentation is about awareness. Can even the best breast center improve outcomes if women continue to present late? No, the answer is no. Breast cancer was and is still today a taboo issue, and that is why majority present in the advanced stages. We established a foundation named after my mother to create awareness, reach out to the community, and support breast cancer survivors and empower women and impact lives. To me, the four pillars of advocacy are: first, priming the community, initiating conversations and dispelling taboos. Because just because I've come back from the United Kingdom, just because I have worked in centers of excellence, it doesn't mean people will accept me. I had to get into the community. I had to engage with the community. That's the first step I did. I then built trust through awareness drives. And the third component of advocacy is establishing political advocacy, influencing policymakers by inviting them, getting them to see what you're doing, and finally, to take advocacy mainstream, embedding it in public health discourse. These were the principles that I followed over the past 19 years. If I have to break down the advocacy into two phases, they were between The first 10 years, that is 2007 to 2017, we focused on priming the community, engaging with them, and empowering them. And now, in the last 10 years, we have scaled the awareness through technology. To highlight what we did in the first phase, rather than me speaking, if you get a celebrity survivor, we call them conquerors, if they come and they speak and they perform, people will take notice. This is a well-recognized fact. So I cajoled and pleaded with the lead singer of Boney M. Those of you who are my generation and older will know about Boney M. She is a breast cancer survivor, conqueror, who had spine metastasis. She flew down. Normally, she charges a very heavy amount. I said that as a matter of principle, the foundation will not pay you anything, but we will provide you local hospitality. This is the first time I'm hearing something like this, doctor, is what she said. But she came, she performed, she enthralled 10,000 people in Hyderabad International Convention Centre in 2008. That's when people started taking notice about what this foundation is doing. We had Asha Bhosle, who recently passed away sadly, but one of the legendary singers who came to Hyderabad at no cost, and she again enthralled thousands and thousands upon people. We had this actor Gautami for the very first time after she was diagnosed with breast cancer. Not only she came, but I prevailed upon her then husband, Kamal Hassan, who was a very well-known actor, to come and speak about this. So very first time they spoke about their illness in Hyderabad. This is Pamela Yash Chopra, who is the wife of the legendary then producer Yash Chopra ji, and she is a breast cancer conqueror. She not only attended our programs, but became our patron, and you've already seen the US ambassador's wife. We launched the Pink Ribbon Walks in the first week of October, which October, as all of you are aware, is International Breast Cancer Awareness Month, where people, survivors, their families, and people from all walks of life come and participate in the Pink Ribbon Walk. When we started off, we had just 50 people participating. Today, when we started doing these programs year on year, we were able to involve women from not only underprivileged background, but also conservative background. This is a patient of mine, 23, after breast cancer surgery with a drain bag. She fights with her husband and comes and flags off the Pink Ribbon Walk. We not only did this Pink Ribbon Walk in Hyderabad, we extended it to neighboring cities, Warangal and Vijayawada, where we had thousands of people who participated in these walks. And the aim of this walk was to create the awareness and salute the survivors, we call them conquerors, in the fight against the disease, and inspire people to go and present themselves for screening. We had people from all walks of life, film stars, sports stars, politicians, and whoever it may be who is prominent. Initially, it would be a tough call for us to invite people and take their time. But a time came over the years when prominent people would contact me and ask me if they can come and flag off the walk. It was that popular. It had a ripple effect. There was unprecedented awareness in the states of Telangana and Andhra Pradesh and beyond. And what is very gratifying is that it inspired individuals, NGOs, hospitals nationwide to launch similar initiatives, not just for breast cancer awareness, but for creating awareness about several other illnesses, which also merit attention. We also spearheaded the Paint the City Pink campaign. This is the Buckingham Palace in pink, and you can see this is the 435-year-old Charminar, which is the historic Charminar that is illuminated every year in pink. This is in Old City, where people are very conservative, and this is to inspire and raise the curiosity. This is the majestic Buddha statue. The Buddha statue is the largest monolithic statue which is in Hyderabad, in a lake which separates Hyderabad from Secunderabad. This is the majestic, newly constructed secretariat. This is the T Hub, where this is one of the largest incubators and startup center in Hyderabad, in the new part of Hyderabad. As you can see how beautifully it is illuminated and stands there majestically. This is the Durgam Cheruvu cable bridge in the upmarket area of Hyderabad, which again is illuminated in pink. It's not just 1 year. This is the Prasad's IMAX, which is the large screen, one of the large screen, centers in the country, where I think huge number of people visit this place. And this is KIMS Hospitals, where I work, which is one of the largest private hospitals in the country with 27 branches across the country. This is the Raj Bhavan, where the head of the state resides. For the first time, the only time that the Raj Bhavan has been illuminated was at the peak of COVID 2020, and it has continued every year. The Honorable Governor invites us to illuminate the Raj Bhavan in pink, and that has been the impact of this Paint the City Pink campaign. I'm just trying to. So all these buildings have been illuminated, including the United States Consulate. This is the Who Wants to Be a Millionaire equivalent in India, which is called the KBC show. During peak time, the viewership is over 90 million. I don't watch this program. A patient of mine asked me to switch on the TV, and there Amitabh Bachchan, who is actually one of India's icons, was asking a question to two celebrity guests in October 2022 to raise awareness about what were monuments illuminated in pink. And fortunately, the celebrity guests gave the right answer. And that has been the impact of this initiative. Since 2007, we published booklets to create awareness about various aspects of breast disease in partnership with Breast Cancer Care UK at that time. It's now called Breast Cancer Now. And these booklets help to counsel, guide, and empower people about various aspects of breast disease, every aspect of breast disease in simple, easy to understand format. And commencing the second phase, that is 2017 onwards, inspired by our Honorable Prime Minister's Digital India dream, we brought out the world's first mobile app on every aspect of breast health, not just in English, but in 11 commonly spoken Indian languages. And it has every conceivable aspect of breast disease is covered, both benign breast disease and breast cancer. And who inaugurated this, who launched this? None other than one of India's icons, Amitabh Bachchan. Normally, he takes a very hefty amount to do any launch. He did it free of cost. He, of course, grilled me for about 2 hours to find out what it was. He got convinced.
May I just offer my services, my voluntary services to this wonderful campaign? If in the future you would require to use my face and my voice towards this campaign, I shall be more than willing to help you. Thank you so much.
And he tweeted about it, and then thousands upon thousands of people have downloaded this app. In 2019, we launched the world's first life-size augmented reality, which is a visionary technology that has a potential for a celebrity or the doctor or both to reach out to a large section of people without being actually physically present and convey a powerful message. And this is Sindhu, a world-renowned badminton champion. In fact, she and I got the Padma Award together. and I realized that we could take her help as a key influencer and leverage the impact of her personal charisma to reach out in the homes of people through augmented reality. And this is a technology where just with you click a button and then the celebrity or the doctor will be in front of you life size in the surroundings of your home, and that is how it looks. Hi everyone. A lot of people ask me this: Doctor, I've noticed a lump in my breast. Is it likely to be cancer? Here are the facts. 9 out of 10 breast lumps are not cancerous and never ever lead to cancer. So this picture that you're seeing, it's a life size in the surroundings of the person's home. And in 2025, I had the opportunity, we have people from Brahma Kumaris here as well. I had the opportunity and the privilege of being involved in the care of Kuldeep Didi, who is the head of Brahma Kumaris. And we felt that there was a need to create awareness in the global headquarters. And we created, we delivered awareness session there, which actually secured 2 Guinness World Records. And bottom left, you see our Honorable Governor, and the bottom right, you see the former Honorable Vice President of India. And in 2026, in this era of artificial intelligence, we have combined healthcare and immersive technology under one platform, and we brought out the world's first artificial intelligence generated holographic educator of me with my face, with my voice, with my life-size 3-dimensional depth image, delivering a 30-minute awareness lecture. Normally, awareness is associated with cancer, but I realized that it's important to do it for benign breast disease as well. And this awareness lesson was for 15 minutes on benign breast disease and 15 minutes on breast cancer. This was followed up with a question and answer session in multiple languages addressed not by me, but by the holographic educator of me, who was answering these questions in English, Hindi, Telugu, and Tamil. And this is just a glimpse of what the holographic educator of me was saying. The primary responsibility of our health lies with us, not with someone else, but with us. Early detection of breast cancer saves lives. So if you are 40 and over, please schedule to have an annual screening mammogram. The primary responsibility after the success of this digital twin of mine, our aim was to create the impact, and we secured a Guinness World Record for this recently, very recently, just a month ago, and that is, you can see the holographic representation of me delivering this talk to a large audience, and this is the chairman of our hospital as well, and me receiving the 3rd Guinness World Record within a span of 15 months. So our aim of doing the hologram was not to actually create awareness through hologram all around the year, because it's a very expensive exercise. So that was to prime the community. And the next chapter has just begun, where a digital avatar of me with my face, with my voice, will provide reliable, evidence-based information about every aspect of breast health, explained in answered in any question 24 hours a day, answered in English, Hindi, Telugu, and Tamil. And this is a website with just a click, www.NARI. NARI stands for National Awareness and Resource Initiative for Breast Health. We've ensured robust ethical guidelines. And as you can see here, during the hologram initiative, I myself asked a question to the holographic representation. Which is the best hospital for breast cancer care in India? As an AI-enabled educational representation of Dr. Raghu Ram, I am not able to recommend specific hospitals, doctors, or treatment centers. The most important thing is to ensure that the person is seen promptly by a qualified doctor or a breast surgeon at an accredited healthcare institution where breast care is offered by a multidisciplinary team. A treating clinician will be the right It will person not give an answer relating to if I want to see Dr. Raghuram or anybody else, it will not give that answer. It is only an educational tool to empower people so that they're better informed, better prepared before they visit the doctor. And just last week, we had a very eminent actor, Shreya Saran, who came and she tried out this Nari. And as you can see here, she asked a question.
Namaskaram. I am Dr. Raghu Ram, a surgeon, founder and chairman of USHALAKSHMI Breast Cancer Foundation and your AI-enabled digital educator for breast health. I am here to answer your questions in English, Hindi, Tamil and Telugu.
Shreya would like to ask a question.
Doctor, what is the right time in a month to come for your examination? Before period, during or after?
It's great that Shreya is thinking about breast awareness. The best time to check your breasts is usually a few days after your period ends. This is when your breasts are least likely to be swollen or tender, making it easier to notice any changes. However, if you notice any new or unusual changes at any time, it's important to see a qualified doctor.
So this was a question to the Nari, and please do spread this word around. And so the real innovation is not artificial intelligence. The real innovation is to be able to democratize reliable breast health information which can be accessible by any woman, anytime, any place in her own language. And this is very recently, Dr. Atul Gawande, as all of you are aware, was interviewed by a very well-known surgeon from America, Vivek Murthy.
AI is not going to replace doctors, but doctors who use AI are going to replace doctors who don't use AI.
So AI is not going to replace doctors. It can never replace doctors, but doctors who use AI are going to replace doctors who don't use AI. That is the future. And so over a 19-year period, as you can see our journey, breast cancer awareness, breast cancer advocacy, has it made an impact? It truly has made an impact. The third component of my presentation is to touch upon screening. Yes, opportunistic screening is the best way to detect cancers. But in a country like India, where 70% reside in rural areas, mammography is not the screening modality of choice in a population-based setting because huge costs, huge variation in mammographic reporting, and the fact is 87% of our population are under the age of 50, where screening mammography is not very effective. And therefore, clinical breast examination has several advantages. There is a lot of evidence to show that it is simple, inexpensive, downsizes the tumor size, excellent opportunity to empower people and reduce the mortality as well. So over a 4-year period between 2012 and 16, in partnership with the governments of Telangana and Andhra Pradesh, we created awareness and implemented a population-based screening program by way of implementing clinical breast examination-based screening by training the healthcare workers, working with the government. That's the then Chief Minister and current Chief Minister of Andhra Pradesh. And these are audiovisual aids and booklets were used and to train these healthcare workers who implemented the screening program to underprivileged women under the age of 65 years from 35 years onwards. And those who were detected with breast cancer were treated free of cost. These are the healthcare workers who were trained, and this is a typical healthcare center where the healthcare educator, the ASHA worker, is empowering them, showing them the audiovisual aid, and then taking them into confidence and then undertaking the screening program. So over a 4-year period, over 200,000 women, underprivileged women, spread across 4,000 villages, were screened for early signs of cancer through clinical breast examination, and cancers that were detected through this initiative were treated free of cost. So this program made national impact, I had written to the Honorable Prime Minister after implementing this program. I was incorporated into the technical advisory group set up by the Government of India, which actually approved clinical breast examination as a population-based screening tool alongside oral cancer and cervical cancer. And this is currently being implemented across the country under the auspices of the National Health Mission. And this is a landmark study from the Tata Memorial Hospital, which has shown significant downstaging of cancer through clinical breast examination based screening program, and also a reduction in mortality in women over the age of 50 years. And so this has been a screening program which is now part and parcel of our screening program nationally. But sadly, only 1% of our population, target population, are being screened for early signs of breast cancer. And I brought this to the notice of our Honorable Prime Minister, where I had the privilege of spending 20 minutes with him, and he listened to this, and I said that much more needs to be done to make this program robust. Very recently, 6 months ago, through the prestigious Professor Charles Balk Research Fellowship from the MD Anderson Cancer Centre, the USHALAKSHMI Breast Cancer Foundation, in partnership with the National Health Mission in Telangana, has conducted a survey, trained and rather retrained the healthcare workers to perform clinical breast examination. And we have presented this study recently at the ASCO, and we will be submitting a document to the Government of India so that they are able to take notice, and this probably will inform them to take necessary steps to make the screening program more robust. The final component of my presentation is to touch upon the Breast Surgical Society. This was one of my dreams, to bring together surgeons practicing breast surgery under one umbrella organization, because abroad, breast surgery is a recognized subspecialty and the concept of organ-based specialists was firmly established. So, inspired by the world's largest breast surgical society, which is the American Society of Breast Surgeons, and the Association of Breast Surgery in the United Kingdom, I had resolved to replicate this success story in India as well. And well before I relocated to India, since 2004, I started utilizing every speaking opportunity in India to talk about the importance of this society. And I garnered the support of several colleagues practicing the art and science of breast surgery across the country. And in 2008, we submitted a proposal to the parent body, the Association of Surgeons of India, which is the world's second largest surgical society, backed by 55 members. Obviously, as expected, there was fierce resistance. Resistance to change is always the biggest obstacle. For 4 years, we couldn't see the light of the day. But leadership is the capacity to translate vision into reality. With determined efforts and gentle diplomacy, there was light at the end of the tunnel, and the general body of the Association of Surgeons of India approved the formation of ABSI in December 2010. ABSI represents general surgeons, surgical oncologists, and plastic surgeons treating breast disease. Unlike ASBRS and ABS UK, I wanted this to be launched as a section of ASI. It was very easy to form a separate society. I wanted this to be part and parcel of the parent body. Why? Because majority of benign breast disease and breast cancer in India is still managed by general surgeons, not by surgical oncologists, not by breast surgeons, but by general surgeons. And therefore, we wanted the general surgical community to benefit from this exercise, and that is why it took so much of efforts for us to form this as a section of ASI. Our core objectives was to promote the art and science of breast disease, to advance the standards of training, to collaborate with national and international organizations, to bring out consensus guidelines as to how women should be managed, Indian solutions to Indian problems, to create public awareness, and hopefully sometime develop breast surgery as a distinct subspecialty. And so over a 14-year period, we have evolved We have done a lot of work. Once again, the breast radiologist is the nerve center for the breast center. And therefore, I convinced, cajoled, and ensured that Professor Laszlo Tabar, who some of you will know is the godfather for breast radiology, he's based out of Sweden. His study showed that screening mammogram saves lives. The Swedish two-county study, which was one of the large randomized controlled trials. He never comes except in business, in first class, and a very hefty fee is charged. I managed to ensure that he doesn't charge and he just comes in business class. And he was not only came once, he came in 2010, he came in 2011, he came in 2012. So much so that several radiologists who actually started developing interest in breast radiology, and that has seen the emergence of the Breast Imaging Society of India, which is a very vibrant society of radiologists actually reporting and doing various breast imaging procedures, which has actually raised the standards of breast imaging reporting in our country. The ABSI conferences that we do every year has actually a simple philosophy: what someone can learn over the weekend that they can apply the next week. And now oncoplastic breast surgery is part and parcel of our scientific program, so much so that 30 to 40% of the program is devoted to the art, discussing, debating, and highlighting the art and science of oncoplastic breast surgery. What about India, rural India, where 70% of our population reside? There are 97 tier 2 and tier 3 towns in India, where 40 to 60% of our population reside. There is a need to empower these general surgeons. So ABSI, during my presidential term, took upon the concept of taking a module, developing a module where basics of benign breast disease and breast cancer are highlighted regarding the assessment and management of these problems. And it's a structured program delivered across the country in these 2-tier and 3-tier towns. We also developed the Indo-UK ABSI Indo-UK Forum Traveling Fellowship, where trainees with a declared interest and subspecialty interest in breast surgery got training in the UK thanks to the Indo-UK Forum and the Association of Breast Surgery. We conducted breast imaging courses because it is important for a surgeon to also do breast ultrasound scan. We have published ABSI consensus guidelines on breast cancer 2017, 2021, and updated in 25. And now we are in the process of developing guidelines for benign breast disease as well. And it is my wish and desire that by 2031, ABSI should evolve from being just a breast surgical society to a breast cancer society, where we are able to integrate breast radiologists and breast pathologists as well, and also develop the concept of breast care nursing, which at the moment is very patchy in our country. So it is my wish and desire that the future of breast healthcare in India should depend not only on breast surgeons and breast radiologists, but on building parallel ecosystems of dedicated breast pathologists and breast care nurses as well. This was a recent editorial that was published in the Indian Journal of Surgery, which is the voice for surgery in India, which highlighted all that we did through the Breast Surgical Society in the first 10 years. I'd just like to echo what our Honorable Prime Minister said, which very much fits into this talk. He speaks in Hindi, but I'm sure you'll understand.
ट्रांसफॉर्म के मंत्र पर चलते हुए भारत ने जो विकास किया है वो हर क्षेत्र में नजर आता है.
What he says is how India is really rising and transforming itself through this mantra of perform, reform, and transform. One of the highlights of my life shall always be the opportunity of meeting and interacting with our Honorable Prime Minister. What was supposed to be a 5-minute meeting went on for 20 minutes, and he gave me his undivided attention, listened to me, spoke to me. We discussed as to how breast health care can be improved and also on several aspects of spirituality. He was very impressed and he made a public statement on the X platform with as to how impressed he was after meeting me and seeing the activities that were done and started following me on the X platform. In conclusion, friends, the rising incidence and mortality and advanced stage at presentation is a cause for great concern. The breast center concept and the awareness advocacy initiatives over the past 2 decades have certainly disrupted breast health care and created that much needed awareness about the importance of early detection. Advocacy, friends, is not merely about creating awareness, it's about building a movement. Although opportunistic breast screening must be encouraged, in India, population-based breast cancer screening program currently can only be delivered through clinical breast examination. The ABSI has certainly done a lot of work, spade work, and tremendous amount of body of work through successive presidents, secretaries, and the executive committee to standardize and pave the path for improving breast health care in India. This was an article that was published just a few days ago, a landmark study that was published in the Nature Medicine, work done by World Health Organization getting the statistics, 5-year survival statistics of women across 190 countries. And as you can see in India, the 5-year survival rate of breast cancers is 65% as opposed to over 88% in high income countries. And this must change. Breast healthcare in India is not about building better hospitals and treating more patients alone. It's about creating a future where every woman, irrespective of where she lives, has access to awareness, early detection, quality care, and hope. Every institution was once an idea. Every movement began with one step. Every transformation was made possible by people who shared a vision and had the courage to challenge the status quo. From when I graduated 35 years ago, I've come a long way. My mother's setback in the form of breast cancer was the driving force. With focus, determination, and hard work, by working alongside like minded colleagues, friends, and the government, we've been able to make a meaningful difference. And certainly, returning to my motherland has been a God sent opportunity. Timing is everything. The divine force placed me at the right time, at the right place, connected me with the right people, and made me do the right things in record time. And there's no place on earth sweeter than home. And I would like to echo what our former People's President, Shri Abdul Kalam, said. Ask what you can do for India and do what has to be done to make India what America and other Western countries are today. Certainly, over the past 19 years, I am very proud to state that I have served as a living bridge between the United Kingdom and India and deeply honored by the recognition, one of the highest honors conferred by the British government. Certainly, without my parents, I'm a nobody. They were there for me when I needed them the most. And so I was there for them when they needed me the most. And that opportunity the force provided. Ladies and gentlemen, it's an emotional time for me. My family, my wife, who is a fertility specialist, she was doing very well, in fact, better than me when we were in the UK. She was on a type 1 program, training at the Barts, and was offered a director's post in Harley Street. We left everything. If she had said at that time, Raghu, we can't go, I couldn't have come back. My dream would have remained a dream. So, Sare Jahan se acha Hindustan hamara. I am once again very grateful to every one of you here on site and online who have been watching this more than 45 minutes presentation of mine, and I'm deeply grateful for this singular honor. Namaskaram and thank you.
Thank you. I have to congratulate you first, Raghu. That is immense work. And we have to say that even sitting here listening to your 7 years, or 11 years, or 14 years of work, I'll ask you a question which is probably just out of the box. As a colleague surgeon, we all came into this training and this profession because we love to operate. That's the crux of it. How much of your time are you still able to give into that bit? Because that always keeps us going.
Good question. To me, being the busiest surgeon in the city is not my aim, has never been my aim. So I'm not in that competition. So I work in a private hospital. I work at a breast center. Patients who come to us, because you don't have fixed operating days, those who come to us, we serve them. And I always tell my patients that my mother had breast cancer. And if you were my relative, this is how I would treat. We don't give kickbacks. We don't have marketing teams. We don't do anything unnecessary. And with a conscience which is clear, I practice the art and science of breast surgery just as I would if I was in the United Kingdom. But the divine force has given me many opportunities to do way beyond just being a surgeon. To me, the operating or be practicing the art and science of breast surgery is just one component of my life. Philanthropy, reaching out to those who need us the most. I've adopted a village. I spend a lot of time in reaching out to them and doing what is necessary there. I'm doing activities through the foundation, and as you have seen, we have embraced artificial intelligence, and I wish to take this NARI, the National Awareness and Resource Initiative for Breast Health, forward. This gives me greater satisfaction than just operating because I don't have to prove myself anymore. I never had to prove myself anymore. I don't enjoy being in the operating theater from morning till night. So I wish to have a life. I wish that I can spend time with my family as well, which I am not able to with all my activities. I still try to do that. But I think it's important to not just focus only on operating. That's to me, that's my philosophy.
With breast cancer, I mean, certainly here in the UK, breast cancer, there is quite a lot of awareness about. But do you think there are lessons from what you've done with breast cancer in India that we could take forward in other less glamorous areas of surgery here in the UK? Because we have a lot of the pink activities and so on, but there are cancers which are barely known about.
Yes.
Are there principles?
So I think it's a very good point, Rachel, because day after tomorrow, I'm giving a talk at the Nehru Center organized by the High Commission of India. There is a big segment of Indian population and people from the Indian subcontinent who still shy away from going for their screening mammography, even in the United Kingdom. They are the people who actually don't go and present themselves for a screening mammogram. I think a lot more must be done to reach out to them. So the fact that I was invited to give this talk coming from overseas, yes, I'm very happy to do that. I think many more such talks and many more innovative initiatives must be done to bring them out of the shell because they're living in the United Kingdom, which offers the best screening program for breast cancer in the world. So I think they must fully take advantage of that. And I'm told that there is a very high non-responder rate from the Indian community. I think that's one area I think the government should focus.
Are there any questions on? Do we have any further questions in the room?
Yeah.
Yes, please.
Hello. My name is Mwaria. I'm a doctor from Kenya. My question is, as a doctor, rather doctors can be very focused on the clinical aspect. When you moved your career into building the breast cancer center and scaling it, what additional skills did you have to learn or did you find valuable in that journey?
Good question. So, when I went back, as you have seen, with a vision and a mission to improve breast health care. That takes more than clinical acumen and surgical skills to be able to implement what we've been able to do. So, basically, diplomacy, meeting people, engaging with people from all walks of life, trying to understand them, taking them into confidence, and getting them to do what you want to do. So that was actually an exercise which actually I learned on the, whilst doing this, because it's not easy to interact with someone who's not from your profession and then go down to, basically, it's not going down, to be on his level, to make friendship with him, and for him to understand why you are there, why you have come back to India, why I came back to India, is a central point in our discussions. And through these discussions, friendships, engagements, I've been able to get many people to help us, and that's why we've been able to do so many things. It's not possible for me to do. It is because of so many people from so many walks of life who have supported us and helped us.
I just want to say, I really want to thank you so much. There are no words for thanking you. What is the source of motivation within yourself?
My mother. So I relocated back for my mother, to care for my mother and obviously my father, and serve my motherland. As I said in my talk, they were there for me when I needed them the most. To me, it's not the awards, it's not the rewards, it's not the work or the body of work that has been done. To me, if somebody asks me what has been the greatest moment or moments in your life, to me, the greatest moments in my life are the God given opportunity to be able to look after my mother and father when they needed me the most. Because no amount of satisfaction can match that kind of service that you can give back to your parents. And although my mother left this physical world a year and a half ago and my father 6 years ago, I still believe in my morning, evening and bedtime prayers that they are with me, guiding me and blessing me. So that is the inspiration for me on a daily basis.
Thank you very much. That was quite inspirational, especially for some of us that are actually from environments like India. I'm a Nigerian. I work here at LSE, the health economics side of things, but I also do sometimes like part-time work in NHS as a doctor. I'm just curious. I'm basically building on the last questions. Move from here back to India. That was a huge risk. That could have actually been disastrous. We've also seen people move down and then they struggle and then they move back. But I also realize, we have these conversations, but realize that if we are being realistic, where you have the biggest opportunity to actually create real impact, real time, where there's that need, actually is in environments like yours or Nigeria. So for young professionals, here in the UK, for instance. So what's your general advice in terms of those that want to have the similar impact in their places of origin, so to say?
With hand on my heart, I can say, having lived in the United Kingdom for 10 years and now 19 years back in India, there is no place in the world sweeter than home, because even if I had lived here for many lifetimes in the United Kingdom, no disrespect, but I would have been part of the system here. I would not have been able to make any difference in the system. But going back to India, I was at the right time, right place, connected with the right people, and the force gave me the opportunity to do a lot more. And therefore, my advice to people who come from overseas, pick up the best, learn what you can, go back to your country, go back to your roots, and do what you can in your roots to make that place the best place in the world for that particular aspect. That would be my advice.
Thank you so much. Thank you.
Well, I think that's absolutely the place to finish and remember that as one of your parting advice to us. Thank you so much for the tour de force you've given us today. Thank you for what you've done over the last 19 years. And it's funny to think of, I was a new consultant just at the time you were sort of senior registrar, and think back then that 20 years later, whatever we'd be standing here today is quite, we'd never have guessed it, would we?
Absolutely.
So thank you so much for honouring us tonight. Thank you to everyone who's participated both in person and online. There will be a recording of the lecture available on the website if you want to catch up on anything. And I hope to see some or all of you again for our future lectures, which will be advertised in due course. Thank you very much.
Thank you very much. Well done.